Hello, my name is Maxwell Richards and I'm currently a senior at Lynn University. For my internship, I worked at a company called Boca Home Care and Boca Home Care Services, which are sister companies under the same roof. Boca Home Care is a Medicare certified home health care agency. The sister company, Boca Home Care Services, is a private duty agency. I worked there for a little over a year, and my official position title was administrative assistant. That basically entails doing everything at the company. My duties included, but were not limited to, visiting patients, delivering medical equipment to patients, picking up medical equipment that were low in the office, faxing orders to doctors' offices, going to certain doctors' offices and picking up important documents and handing them important documents to be signed, installing medical machines in patients' homes, filing papers, faxing documents, um, putting papers in the correct order in patients' charts, and any sort of project that came up while I was there. The projects were things like updating home health aid insurance cards, moving hundreds of files from one program to another, constantly updating patient and nursing information, basically anything that came up that was time consuming and they needed someone to do. Now I'll explain the difference between the two companies. Boca Home Care is the Medicare side of the business. It takes care of sick or hurt people who are still living in their home. Everything is done by a skilled nurse. The nursing we offer is nursing care, physical therapy, speech therapy, occupational therapy, medical social worker, and home health aides. Everything we do must be approved by a doctor, and we need signed forms from the person's doctor. If we don't get the signed forms, we don't get paid, and that's a very important thing. For the sister company, Boca Home Care Services, it's a little different. Our clients either have long-term care policies through things like insurance companies that they can use to pay us, or they can pay directly out of pocket. The private side consists purely of home health aides, who are all independent contractors. When we provide aids to patients, it can be in their own home if they want, or we also can send aids to facilities, places like hospitals or rehab centers. The duties of the aides are basically to help the people in everyday chores and giving them assistance in areas they would have trouble because of old age. Those things include cooking, light housework, bathing, getting around the house, and even things like going to doctor's appointments and the grocery store. It is someone just to help the person. All the aides that we have are certified and have the required training that are required by law. We also made sure that they have their up-to-date car insurance, that they're driving the patients around, they're legal citizens, and all the things that are required by law uh, to have us covered. Um, Overall, I would rate my experience at Boca Home Care Services out of 10 and 11. It was an awesome experience to work for, and I learned a lot. And the people I worked for were very nice and very helpful to me whenever I needed anything. I also think working in the healthcare field, especially with the elderly, was a very good opportunity. I only see that business growing with time, and especially with the baby boomers retired, they will eventually need some sort of help, and business will just grow as a whole. As people are living longer and longer with advances in modern medicine, the healthcare field is a very good field to be in. Also, working at the position I did, I was able to learn the business and how it works from the bottom to the top, so I have a very good understanding of how the whole thing works. I would recommend that anyone work for Boca Home Care or Boca Home Care Services. They are a great company to work for, and they can teach you, and they can teach anyone who wants to learn about the healthcare field, especially home healthcare business.